saya pakai ini gimana?
Tidak akan hilang
Lebih bagus ini.
dari kalbu.
Iya.
Tanahku yang ku
Halo.
cintai.
Suaranya bagus mana, bulat mana?
Lebih bulat yang ini udah. Ya,
Bulat yang ini.
pakai speaker kayak lebih kecil.
Halo.
Halo? Iya nih, lebih kuat yang ini Bunda.
Yang sedang saya Bunda pakai.
Iya Bunda.
Udah diganti soalnya jadi macam
Tanah airku tidak kulupakan, kan terkenal selama hidupku. Biarpun saya pergi jauh, tidak akan hilang dari kalbu.
A warm welcome to our esteemed faculty members who have attended. If you haven't renamed yourself yet, please do so according to the format name_institution. And we kindly ask to all attendees to turn on your camera and use the virtual background. It can be downloaded in the chat section. Okay, without further ado, let's get the event started. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Shalom, Om Swastiastu, Namo Buddhaya, greetings of goodwill, and peace be upon us all. Honorable Dean of the Faculty of Public Health, Diponegoro University, Dr. Budiono SKM MKes, Head of the Occupational Safety and Health Study Program, Professor Dr. Yuliani Setianingsih SKM MKes, our esteemed speaker, Professor Dr. Victor Hoy Chi Wai bin Abdullah from University Malaya, Malaysia, and Professor Hanifa Mahardeni, SKM, MPH, PhD, as our moderator for today's guest lecture. Good afternoon, distinguished guests, esteemed colleagues, and dear participants. It is my great pleasure to welcome you all to our guest lecture on preventing musculoskeletal disorder in the workplace. I'm Maria Diva. I'll be your master of ceremonies for this enlightening event. Next, I will read out the agenda for today's event. First, opening by MC, safety induction, playing of the Indonesian national anthem, Diponegoro University anthem, and the Faculty of Public Health anthem. Documentation, opening remarks by the Dean Faculty of Public Health Diponegoro University, main lecture, discussion session, closing remarks from speaker, presentation of digital certificates to the speaker, closing remarks from moderator, presentation of digital certificates to the moderator, attendance link filling, and closing. Let us begin this event with a prayer according to our respective faiths and beliefs. Prayer begins. Prayer ends. Before proceeding into the next agenda, let's watch the safety induction video from students of Occupational Safety and Health Diponegoro University as a guide for the health and safety for all attendees. To the committee member in charge, please proceed.
Safety induction. Honorable guests, ladies and gentlemen, we are the students of the Occupational Safety and Health program at the Faculty of Public Health Diponegoro University, serving as the Occupational Safety, Health and Environment team. Before we start the activity, and in accordance with the procedures and standards of occupational safety and health for online activities, please pay attention to the following procedures and compliance requirements. First, position yourself in a proper sitting posture. Do some stretching exercise to prevent musculoskeletal disorders. Adjust the visibility and brightness of your screen. Second, be aware of electrical hazards, such as overloading electrical outlets. Ensure your area is safe from other potential hazards. Third, ensure a stable internet connection, camera, and microphone during the online meeting. The risks and hazards that may occur include fatigue, fire, and earthquakes. In the event of an emergency, keep calm and do not panic. If the situation is safe, please proceed to the nearest open space around you by lowering your head and body to avoid smoke and debris. If you need assistance, please directly contact the public service center nearest to you or call emergency services at 112. Thank you for your attention. We wish you an enjoyable event. Remember to prioritize your health and safety. Together in safety, united in health, striving for zero accident.
Next, let us listen to the Indonesian national anthem, Diponegoro University anthem, and the Faculty of Public Health anthem. Attendees are kindly requested to turn on your cameras and sit properly.
siswa, harapan nusa bangsa, semangat timur negara, kuat demi negara. Kita bekerja belajar, capai cita-cita, junjunglah tinggi bom negara, merdeka. Amalkan lekat satria, patriot paling pernah, mengabdi tanah pusaka, ibu Indonesia, berteladan Pancasila, lambang dunia, junjunglah tinggi bom negara, merdeka. Perjuangan semangat, mulai darimu hai penerus bangsa. Kobar menepi semangat mengabdi, melakukan begitu berguna. Rajin bekerja untuk menuntut ilmu, zaman satu generasi masa depan, bangsa yang sehat, tujuan mulia. Menyelamatkan kita, jaya semasa selama-lamanya. Bulan mendekat, perjuangan semangat, mulai darimu hai penerus bangsa. Kobar menepi semangat mengabdi, melakukan begitu berguna. Rajin bekerja untuk menuntut ilmu, zaman cintamu satu generasi masa depan, bangsa yang sehat, tujuan mulia. Menyelamatkan kita, jaya semasa selama-lamanya.
Next, we will have a virtual group photo session. We kindly ask all the attendees to turn on your cameras and position yourself. To the committee member in charge, please proceed. Okay, for the first pose is formal. Give your best smile in my count. 1, 2, 3. Next slide. 1, 2, 3. Okay, next slide. 1, 2, 3. Okay, for the second pose is zero accident. In my count. 1, 2, 3. Okay, next slide. In my count. 1, 2, 3. Okay, next slide. In my count. 1, 2, 3. Okay. Next in our agenda is the opening remarks by the Dean of the Faculty of Public Health, Diponegoro University, that will be represented by the Deputy Dean, Dr. Sri Winarni, MKes. We now invite Dr. Sri Winarni, MKes, to deliver her speech and officially open the seminar.
Okay. Yeah. Good afternoon. Selamat siang. Assalamualaikum warahmatullahi wabarakatuh. We thank you for our grace for the blessing given to us all. And dear distinguished speaker, Prof. Victor, and respected guests, Prof. Hanifa, Prof. Yuli, faculty member and student, good afternoon and welcome. It is my great pleasure and honor to represent our dean, who unfortunately cannot be with us today due to other important obligation. And okay, it's a great honor and privilege to welcome you to seminar. And I hope this event with them preventing musculoskeletal disorder in the workplace can run smoothly and be successful. And this guest lecturers is more important due to the increased demand for safer and healthier work environment in our industries. And musculoskeletal disorder, as you know, continue to be one of the leading causes of work-related health problems, leading to physical discomfort, a loss of productivity, and large healthcare costs. And today's seminar topics are important in preparing our students and strength knowledge. Let me express my appreciation to our esteemed guest speaker, Prof. Victor Hu C. Y. bin Abdullah from University Malaya, Malaysia, for taking the time to be here. Thank you very much. Your presence and expertise are invaluable to our students and faculty. And I'm sorry. And in closing, I want to thank each of you for being a part of this event. And I wish everyone a rewarding and insightful experience. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh. Selamat siang. Back to MC. Thank you.
Thank you for the remarks and opening by the Deputy Dean of the Faculty of Public Health, Diponegoro University. To the Deputy Dean, Ibu Sri Winarni, if you have any other activities or agenda, please feel free to leave the Zoom meeting.
Thank you, Mbak Maria.
Thank you, Ibu. Now we will move to the main event of today, the guest lecture on preventing musculoskeletal disorder in the workplace. It is my pleasure to introduce our moderator for today's seminar, Professor Hanifa Mahardeni, SKM, MPH, PhD, is a renowned expert in the field of public health with a particular focus on occupational safety and health. Professor Hanifa holds a PhD in public health from the University of South Florida and MPH from the University of the Philippines, and bachelor degrees in public health from Diponegoro University. Currently serving as an associate professor of the Department of Occupational Health and Safety, College of Public Health, Diponegoro University. Professor Hanifa has an impressive track record in academic, research, and consultancy. She has held several key positions, including Dean of the College of Public Health at Diponegoro University, Director of the Undergraduate Study Program in Public Health, Chairperson of the Department of Occupational Safety. Professor Hanifa's expertise has been recognized internationally. She has been a consultant for various organizations, including the WHO and ILO, focusing on occupational health services and safety in Indonesia and the broader Southeast Asia region. Professor Hanifa also earned several prestigious awards with her vast experience and expertise. We are honored to have Prof. Hanifa as our moderator today. Please welcome our moderator, Professor Hanifa Mahardeni, SKM, MPH, PhD. Okay. How are you, Professor? Are you ready to moderate today's discussion?
Okay, thank you. Sorry, Master of Ceremony, thank you very much for today. So I am so happy because today we have a guest lecture. He's very well known also internationally, and we met Professor Victor Hu Chi Wei bin Abdullah. He is also, let me introduce his great experiences. He is also a renowned professor specializing in occupational safety and health. If I would like to share about his experience, and here, okay, Professor Victor Huchiwai bin Abdullah. He is the professor from the Department of Social and Prevention Medicine, Faculty of Medicine, University Malaya. He is also very important person, VVIP also. He is a renowned professor specializing in occupational and public health. He leads the Department of Social and Preventive Medicine at the Faculty of Medicine, University of Malaya, and also directs the Occupational Health, Safety, and Environmental Health Unit at University Malaya Medical Center. With his academic qualifications, including a PhD from Monash University and multiple master's degrees and specialization in public health, occupational health, and safety engineering, he has significantly contributed to occupational safety and health, environmental health, preventive medicines, and also public health. Prof. Who or Prof. Victor, it's easy for us to spell his name because it's quite challenging for me to pronounce Professor Victor Huchi. I think I apologize if my pronunciation is not perfect. So Professor Victor is actively involved in academic leadership, research, and also innovative educational methods, especially in online learning and public health interventions. He is also a fellow of the Academy of Medicine Malaysia and has received numerous national and international awards from his contributions to the fields. We met Professor Victor when we were in the International Congress on Occupational Safety and Health in Morocco. So, and we are glad that he just responded our email very gladly, and he is available for today with us. Professor Victor, the screen is yours. Thank you.
Thank you very much. Thank you, Hanifa, for the kind introduction. I hope that everybody can hear, is able to hear what I'm saying now. All right, and thank you, the MC Maria, for having such a nice event. All right, so I would share my screen so that I would be able to project. Okay, let me see where to share my screen. Share screen. All right. Okay, let me put this one here first. Sorry, wrong screen. Wait, let me share again. Okay, can you see the screen? Can you see the screen? All right, I think you should be able to see the screen. All right, great. Okay. Hi, good afternoon, everybody. Good afternoon, everybody. Selamat siang. And I'm Professor Dr. Victor Ho from the Department of Social Preventive Medicine, Faculty of Medicine, University of Malaya. Today, I'm going to present to you on preventing musculoskeletal disorder in the workplace. And it is a pleasure for me to come to Diponegoro University, and of course virtually. And I hope that next time we can meet physically so that I can see you all. All right. I'm continuing. Sorry. So I have a degree. I'm a medical doctor with a degree in public health. So occupational health, engineering, Masters of Occupational Safety and Health, and a PhD from Monash University. So musculoskeletal disease, or MSD for short, is an inflammatory and degenerative disorder affecting the muscles, tendon, ligaments, joints, peripheral nerve, and supporting blood vessels. And we can classify it basically based on two specific classification. That it can be a called specific condition. That means the musculoskeletal disease affecting specific joints and also specific pathology. Or we can also look at it from a non-specific condition, which is most of the time when we see musculoskeletal disorder in the workplace, it is more of a non-specific condition rather than a specific condition or a specific pathology or disease. So musculoskeletal disease can be divided in, can come from different areas of the body. It can be tendon-related disorder, peripheral nerve entrapment, musculoskeletal muscle-related disorder, neuromuscular or vascular disorder, joint and joint capsule disorder, or bursa-related disorder. So tendon-related disorder can consist of tendonitis, peritendinitis, tenosynovitis, synovitis, epicondylitis, decubans disease, Dupuytren contracture, trigger finger, and ganglion cysts. The peripheral nerve entrapment can come from any of the nerve being entrapped in a tunnel, like the carpal tunnel syndrome, cubital tunnel syndrome, Guyon canal syndrome, pronator teres syndrome, radial tunnel syndrome, thoracic outlet syndrome, cervical syndrome, and digital neuritis. Muscle-related disorder can consist of tension neck syndrome, muscle sprain and strain, or myalgia and myositis. Neuromuscular or vascular disorder can be Raynaud's syndrome, hand-arm vibration syndrome, hypotenuse hammer syndrome. The capsule disorder can be osteoarthritis, and of course, bursa-related disorder is bursitis or inflammation of the bursa. So there's few areas or few joints in our body that actually have bursa, and there's the inflammation of the bursa. So muscular disorder condition constitute a major public health burden and have a major impact on the society. If we look at the global burden of disease prevalence in 2019, lower back disorder and neck pain constitute 8 and 3% of the total musculoskeletal total global burden of disease. This is focusing only on general disorder, all right? So this is derived from the Global Health Data Exchange. Low back pain of all ages, prevalent cases per 1,000, it shows that there is in 1990 and in 2019 show that there's an increase in the number of cases over that period from 1990 to 2019. Same for neck pain also, from 1990 to 2019, there is an increase in the number of cases over the same period. Global estimate of the year lived with disability, we want to understand, because musculoskeletal disorder does not cause more mortality. That means it does not kill the person, but it causes a lot of disability. That means you are basically you have pain which causes disability, and the disability is the one that makes you, as mentioned earlier, decrease in productivity. All right. So year lived with disability, or YLD, is a measures that we use to basically to ascertain how much of the years a person have where there is disability. So we are looking at years lived with disability per 100,000 population due to low back pain from occupational risk factor. This is talking about occupational risk factor from 2021 to 2020. We'll look at it, of course, the younger there's less, but between 50 and 69, your years lived with disability increases, and after that, it decreases again. So that shows that when you're young, the musculoskeletal disorder might not be a problem, but it actually would become a problem when you grow older, when you're between 50 and 69 years old. So the number is actually coming down if you look at the trend, but it is still an issue. This is global estimate. This is global trend. If you look at the global trend, is basically between around 500. From 500 it comes up to 400 per 100,000 population for people aged between 50 and 69 years. This is the Malaysian estimate. If you look at Malaysia, the number is much lower compared to the global. If you look at it, but it's also coming down. All right. So this as I mentioned, is years lived with disability. But let us look at what is happening in Indonesia. All right. So Indonesia, the number are not really coming down. It is still high, and you look at it, the number is actually almost similar to the global estimate, between 500. It's actually 500 to 600 per 100,000 population. That means in Indonesia, compared to Malaysia or compared to global, musculoskeletal issue that leads to low back pain, that from occupational risk factor, is still a problem among workers from 50 to 69 and also from 15 to 49. That means from 15 to 69 years old. So it's still an issue, and that is important for you all to understand. And that is important for you all that you are the one that's going to ensure that this will be reduced in your workplace. This map shows the low back pain attributed to occupational ergonomic risk factor, both sexes in 1990, prevalent cases of 100,000. And in 2019, you look at the number actually have increasing, and you look at Indonesia is actually orange, which is basically high. That's what is shown around that the number has been shown just now. All right. So if you look at it again, look at the global estimate of global disease and injury percentage attributed to occupation risk factor. These are looking at it from years lived with disability, because we cannot look at mortality, because musculoskeletal disorder does not cause mortality, does not kill the worker, but it causes a lot of disability. That means you have the disease and you become disabled, unable to carry out your work. And look at it from the global estimate, look at it, low back pain accounts for around 25% or of the around 25% of all the years lived with disability due to occupational risk factor among males, and around 20% for years lived with disability attributed to occupational risk factor among females. But in Indonesia, the number is much higher, all right? And coming together with low back pain and unintentional injuries is almost what it covers almost all the years lived with disability attributed to occupational risk factor. So look at low back pain is 40%, all right, which is basically compared to the 25% global estimate, 40% of the workers' disability is due to low back pain for the male, and for female is around 30%, which is much higher than the 20%. So the burden of disease, the burden of low back pain on occupational disease is prevalent, is an important issue in Indonesia. Years with disability due to musculoskeletal disorder globally in Indonesia and Malaysia may be decreasing because of changes in employment distribution. Globally, it's decreasing. In Malaysia, it's increasing. In Indonesia, the trend is not that clear. But there are basically employment changes that would decrease the number of low back pain. We hope that the trend will decrease later. But there are still substantial number of workers who are disabled every year from MSD. This indicates that occupational MSD is still an important condition that needs to be addressed and managed in an appropriate manner. So from your perspective as learning occupational safety and health, MSD is still a major problem, especially in Indonesia. Look at it from, there's around 50% of the years lived with disabilities. The disability is due to, from occupational risk factor, is due to musculoskeletal disorder from low back pain. We only covered low back pain because the data is available for low back pain and not for other pain. This is just a few studies that we actually have found, and this is from Malaysian data. I don't have the time. I don't have time to actually look at Indonesian data, but looking at Malaysian data and looking at it from what are the prevalence of overall prevalence of MSD in Malaysia: neck pain, shoulder pain, elbow pain, low back pain. So low back pain is still the highest. Then it comes to neck pain. So both the low back pain and neck pain constitute the most common musculoskeletal disorder in Malaysia. So we use basically the data is derived from multiple research, and this research using reporting prevalence, and we use what we call a forest plot to actually plot the information and come up with the estimate. So for migrant worker, the number of prevalence of low back pain among different group of workers in Malaysia, for migrant worker is low, for office worker is high, all right. For commercial drivers also is high, is 0.66. This is in percentage, all right. So this is prevalence in percentage. So for migrant workers, it's only 0.19%. Positive means 19%, and in office workers, 83%. All right. But in commercial drivers, is 60%, and in dental work is 48%. And teachers is around 48%, Hospital doctors is around 60%. Academician, that means us here sitting here, is around 36%. Railway workers is around 35%. Plantation workers is also is 64%. Construction workers, only one study shows 98%. Other studies like electronic factory workers is around and batik workers is around 38.34%. And these are other studies. So the data actually shows that different occupations have different prevalence, and also the data also shows that not all is around 50% or more than 50% of people are reporting low back pain. So we now know the burden of low back pain. We know the burden. We know that different industry have different risk factor, different prevalence for low back pain, and we know also the burden of low back pain in Indonesia. And of course, low back pain is just one way of looking at from musculoskeletal disorder. Now we look at what are the risk factors for musculoskeletal disorder. So the risk factor for musculoskeletal disorder can be summarized in this diagram. All right. So it can be a genetic factor which can predispose you to low back pain. It can be anthropometric characteristic. That means your height, how tall are you, how big are you, how easy you move, the movement of your muscles. All right. And also can be psychological profile, like tension, like psychological profile of yourself. How susceptible are you to pain? When you are having pain, how susceptible are you to actually report the pain? And how susceptible are you to feel disabled due to the pain? All right. And of course, the other one is biomechanical factor. These are how you lifting and things like that. So it leads to constraint, and then there's anatomical structure, where there's tension, compression, tear, elasticity, constraint, instability, and microtrauma. So musculoskeletal disorder, which is a non-specific condition, is due to what we call microtrauma. So microtrauma is where you have small trauma in your muscles that eventually becomes disorder and become pain. All right. So there are proper increase in occurrence of a lesion and gradual decrease in the lesion threshold. So there's danger, there's perception of pain, then there's pain, then there's living with pain. All right. So these are some of the factors that actually summarize this slide summarize the risk factor for musculoskeletal disorder. Of course, we can also look at it from the perception of exposure that leads to musculoskeletal disorder. We're just looking at it from the stress perspective. We can look at stress. It means what exposure you get. You stress on your muscle. You have assertion, that means how much you lift or what is the weight that you do. That's called repetitive motion, or the terminology is repetitive strain injury. That means if you move more often, then you get your increase in stress. Of course, the extreme posture. Extreme posture means that you are basically working in a posture not naturally or not in a natural posture. So extreme posture, repetitive motion, and assertion lead to stress. And then we look at it from the functional capacity, the individual response to stress. You must understand that every individual have different response. That's why some places, even if you look at it from office worker, even though the stress is low, but the prevalence is high because of the functional capacity or the individual resistance. So the functional capacity can be from physical fitness. Most of the time, office workers are less fit compared to other workers which is working in the field. Aging, that means when you grow old, your muscles become less easy to move, and that is where the problem. Of course, stress itself, this is mental stress. This is not physical stress on your muscle, but mental stress itself. So somatic, what we call that, presentation. Musculoskeletal pain can actually be part of the somatic presentation. That means having stress can lead you to complain of pain without any physical risk itself. So that is important for you to look at it. Of course, the other thing is patient-related factors like patient diseases, like having diabetes, having obesity, and other kind of diseases can actually predispose you to increased risk of musculoskeletal disorder, focusing on occupational exposure. Are you okay? Right, let us continue. So we will continue by looking at different different anatomical site, and then we look at what kind of different anatomical site and what kind of evidence to show that available to show that there is workplace musculoskeletal disorder, right? So we divide the evidence into strong evidence, reasonable evidence, and insufficient evidence. So the strong evidence that shows that there's neck and musculoskeletal disorder is psychosocial factor. That means the way an individual react to pain. So it's psychosocial or somatic symptom, or how you actually respond to pain. Every individual have respond to pain. Smoking is a problem, and of course, smoking is still very prevalent in Indonesia. Gender, females are more predisposed to pain than male, and of course, posture and other comorbidity like your cardiovascular disease, like your diabetes, like your obesity. Insufficient evidence is heavy physical work, lifting, sedentary work, older age, and higher BMI. Back pain, the same thing. There's no strong evidence, but reasonable evidence is awkward posture, heavy physical work, lifting, psychosocial factor, younger age, and high BMI. And insufficient evidence is gender, race, smoking, and comorbidity. And then you have non-specific upper limb work musculoskeletal disorder. We're not discussing of your nerve entrapment syndrome. We're talking about musculoskeletal disorder on a whole, not the nerve entrapment syndrome itself. So reasonable evidence is comorbidities, insufficient evidence, psychosocial factor, older age, smoking, heavy physical work, and high BMI. Shoulder pain, the same heavy physical work, psychosocial factors, and insufficient is repetitive work, older age, higher BMI, and sedentarism. Elbow and forearm pain is outward posture, comorbidity, repetitive work, and older adults, and older age, sorry. And insufficient evidence is high BMI, heavy physical work, female gender, monotonous work, associated upper limb disorder, and workplace musculoskeletal. Associated upper limb workplace musculoskeletal disorder. Wrist and hand is prolonged computer work, heavy physical work, high BMI, older age, female gender, upward posture, and repetitive work. So wrist and hand MSD, basically we're talking about MSD that affect your wrist and hand, not including carpal tunnel syndrome. By carpal tunnel syndrome, we already know the risk factor. So insufficient evidence, smoking, comorbidity, and psychosocial factor. Non-specific lower limb is most of it comorbidity, psychosocial factors, smoking, and high BMI. And hip development is lifting, heavy physical work. All right. Of course, we know lifting and heavy physical work are insufficient, unable to work properly, and repetitive work. And knee musculoskeletal disorder is outward posture, lifting, repetitive work, and comorbidity. So insufficient evidence is psychological factor, smoking, heavy physical work, and high BMI. So those are what we call risk factor that is related. We're talking about non-specific musculoskeletal disorder that don't have specific pathological findings except for pain, maybe inflammation, but there's no specific findings like nerve entrapment syndrome, which is the most common nerve entrapment syndrome that we see in the workplace is carpal tunnel syndrome. Okay, so work-related carpal tunnel syndrome, you must understand the median nerve goes through the carpal tunnel, and that is where you get your lateral 2/3 of your fingers become numb, and there's also numbness. There's also other neurological signs and also hematological signs. So reasonable evidence for regular prolonged use of handheld powered vibration tools. So vibration itself can cause two problems. Handheld vibration to get two problems. One is basically damage to the nerve also, but also cause carpal tunnel syndrome. The other problem, of course, we know that using hand arm vibration tools, we can get hand arm vibration syndrome, which is a neurovascular problem or vascular problem, which leads to Raynaud phenomena and your vibration white finger, where your finger becomes white, right? So substantial evidence to have similar or higher risk from prolonged and high repetitive flexion and extension of the wrist, especially when like with forceful grip. So gripping and extension and flexion would also increase risk of carpal tunnel syndrome. On the balance of evidence, keyboard and computer use do not cause carpal tunnel syndrome. It's not keyboard and computer work alone. Some people do get it, but it is more on other factors. You must understand that when we talk about keyboard and computer use, keyboard was a problem for carpal tunnel syndrome because when we talk about keyboard, we're not talking about keyboard, we're talking about typewriter at the point of time. When you're talking about typewriter, your hand, how your hand actually used to type is different from a keyboard that we use currently. And how much force you need to use a typewriter is different from when you use a keyboard currently. These are just a summarize of risk factor for non-specific muscular disorder. So extrinsic, so we can have an extrinsic factor. That means factor that is not individual factor, and also get intrinsic factor or individual factor. So the extrinsic factor can be repetitive work, pace, repetitive motion, precision work, heavy lifting and forceful exertion, non-neutral body posture, prolonged work in sedentary posture, and mechanical pressure and vibration for the physical component. But organization or psychosocial component also plays an important role when we talk about non-specific musculoskeletal disorder. Organization and psychosocial factor like poor job content. What do you mean by poor job content? That means your job itself is monotonous, or it does not provide the psychosocial, psychological input that is required. Low job control, that means you're unable to control what you do, understand what you do. Lack of social and co-worker support, increased job demand, job dissatisfaction, and job insecurity also can lead to what we call, due to somatic symptom, people can complain of non-specific musculoskeletal disorder. So this disorder is not 100% due to risk factor of the muscular, but also due to the factors that it is a psychosomatic disorder. It is not to say that we are dismissing people with pain, but we are telling that some people with pain might not be 100% physical. It might be other than, it might be organization or psychosocial. Intrinsic and individual factors like female gender, younger or older age, previous history of MSD, low physical activity, high BMI, and being a smoker are also some of the factors that can be related to non-specific musculoskeletal disorder. So I have conducted a few studies, all right, and this is basically to show you determinants of multi-site musculoskeletal disorder among school teachers in Malaysia. So a total of 6,796 teachers from 328 schools were screened or were surveyed, and with a mean age of 41.16 years, and 79.5% is female, and and around 80% is Malay ethnicity. The data was derived from the cluster study. Cluster is the study that on teachers, right? So prevalence based on number of anatomical and musculoskeletal pain among participants in the past 12 months. So we look at it that there are people reporting in single site pain is much more is less common than multi-site pain. When you have musculoskeletal pain, you usually report from more than one side. You don't just report your wrist pain, but your wrist pain and your arm pain and your shoulder pain. So you don't report just single side pain. So more than two side pain is basically, that means 3 or more side pain is actually higher, especially you're talking about in the past 12 months. The finding found out that pain of 3 or more sides increased with female gender, overweight, obesity, hypocholesterolemia, a moderate extreme anxiety, high job demand, low social support. Also associated with reduced mental and physical health. So which means that due to the pain, actually you have a reduced mental and physical health. So now we have known the risk factor. We have known the burden of musculoskeletal disorder. We'll move to prevention of musculoskeletal disorder. Work-related musculoskeletal disorder. So musculoskeletal disorder does not come just like that. It is not that it's become a problem or become a pain instantaneously. It comes from different symptoms that actually progress to become worse. You start with fatigue or discomfort, which you consider it normal, right? Then occasional movement problem, and then you have small ache. Then you have soreness, have pain affecting performance. Then you pronounced symptom, then disorder, injury, disease, and then only disability. So the important consideration is that once you have feeling discomfort or pain, you need to look at it whether this actually is due to the workplace or not, is due to the work component or not. So the work component, you can look at it from the physical part and also from the psychosocial part. So to manage a musculoskeletal disorder, you cannot just looking at the physical risk factor, but also the psychosocial risk factor.
Excuse me, Professor, you haven't unmute your mic.
Yeah, okay, so I unmute. All right, I got disconnected. Sorry about that. All right, I would start again, screen to share. All right. So, all right, thank you very much for, okay, so you can see the screen again. So I was saying that if from a safety and health office, from occupational safety and health perspective, you need to ensure that you must identify a risk factor to prevent injury, and also to not just injury, but also to look at it from the physical and psychosocial perspective. So you can prevent injury, you can prevent pain, disability, and then stop work. The main concept is to allow people to continue to work in their current workplace. So the management of work-related MSD is, when we look at MSD itself, as a medical officer, as a doctor, we look at MSD itself, we look at sign and symptom of MSD. Then we diagnose whether it's MSD or not. Then after that, we look to workplace assessment. And after that, we say, is the MSD due to work or not? Then, of course, when we look at it, when you do to work, can be individual factor. We must act on individual factor and also workplace factor. We must look at it from both perspectives of how to control, what kind of individual factor lead to musculoskeletal disorder, what kind of work factor lead to musculoskeletal disorder. And we, as a safety and health officer, we need to manage both of these, not just on workplace factor. Because managing workplace factor alone can actually reduce it, but you also need to look at it from the general health perspective or wellness, from the wellness, to the angle of the wellness, So currently, you must not just look at it from the safety and health perspective, but also on the wellness perspective. Wellness is an important component. So it's MSD, so active worker, advised worker and supervisor, if they're informed of appropriate authorities of workers' compensation, review occupational safety and health risk, and control measure. So evaluate reassignment possibility. This is basically when you have been diagnosed with musculoskeletal disorder. That's what we're going to do. We're going to evaluate reassignment, whether we give you a new job or give you a different job. Then we develop a treatment plan, and we call it communication of illness to injury. Of course, when you talk about review occupational risk, we must look at hazard identification, risk assessment, and look at how can we conduct health promotion. Right. So when we talk about MSD, most of the time we talk about the risk is due to agronomics. All right. So agronomics is one of the main scope when we talk about MSD. All right. So what is agronomic? I'm sure all of you understand what is agronomic, but let me just give you a rundown. All right. So agronomic is basically comes from the Greek word agro and norms, which is law of the work. All right. So agronomic matches the tasks and abilities of the worker, fitting the task to the worker. So that's called agronomics. So agronomics look at three components, not domain, three factors, which is the human, that means the individual, the product, and the system. We just don't look at the product without looking at system, but also product and the system. That means how the product is being used in the system itself. So the individual, the product, and the system. So goal of agronomics is to look at it from three perspectives. All right. We look at it from whether we're giving it a tolerable working condition. That means it does not produce any musculoskeletal disorder, does not pose any danger to your health. But we also will look at it from the perspective of acceptable condition, whether the individuals accept it or not. We must understand that depending on your education, depending on your cultural background, depending on certain issues, it might be tolerable. That means that might not cause any occupational health problem, but it might not be acceptable. And of course, the best is to get an optimum condition, well adapted to human characteristic, capability, desire, that physical, mental, and social well-being is achieved. So that's why sometimes we look at only physical component is not enough. We must also look at physical, mental, and social well-being. So what does it do? It improves safety and health, reduce number of severity of workplace injuries, reduce probability of catastrophic human error. So when you look at agronomic itself, which we are going to explain later, you got the three domains, and the one of the domain is basically reduce safety and health. Of course, improve effectiveness, increase productivity, and reduce error. Anticipate and response to external and internal pressure like regulation and litigation, and accommodating a diverse working population. So the domains, that is why I'm coming to domains of agronomic. So when we talk about domains, most of the time we focus on physical domain, which is where we talk about fitting the person to the work. And this is basically what we focus on agronomic for musculoskeletal disorder. But we must also understand from the lecture from what I mentioned just now, musculoskeletal disorder does not only depend on physical domain, but also on organization domain. So the organization domain, how the work is designed for the worker to complete. Is there any time off? Is there any time to actually take rest? Of course, the cognitive part of it is important. Cognitive part is more on how you react to how your brain actually, what's your, are you trained to actually react to certain input or impulse, or what action you're going to take based on your cognitive connection, or how much information is presented to you, and whether your training and your whether you have ability to actually interpret those information or data itself. So those are the cognitive components. So ergonomics consists of physical, cognitive, and organizational. So let us go back to a simple component of 10 ergonomics. So there's 10 rules of ergonomics, which is to reduce excessive forces, reduce excessive motion, maintain a neutral posture, work at proper height, keep everything within easy reach, minimize fatigue and static load, minimize pressure point, provide clearance, maintain a comfortable environment. Of course, the main thing about what we call to reduce musculoskeletal disorder is not just improve the workplace, but also to ensure that the workers are being able to move, exercise, and stretch. That means movement is important, not just what. That's why sitting here, just now your lecture actually for safety and health actually look at it from the perspective of how long we sit and how to sit, but it actually did not put into consideration what should we do. Move, get up, stand up, and just exercise in between. So sitting for 1 hour, is it a healthy thing to do, or do we need to get up? Right. So reduce excessive forces is that we need to live close to our body, because we understand that this is from your physics, or from your liver perspective. When the item is far away from your body, it becomes much more heavier when it's close to your body. The same weight actually increase on your that. The 5 kg would be 5 kg if it's close to your body, but it will be 50 kg if it's away from your body. And that stress actually put on your low back, and that's where you got injury, and that's where you get low back pain. Of course, the other thing that you need to do is to reduce excessive forces is for good coupling grip, all right? And of course, pushing is better than pulling. So to push is better than to pull, all right? If it's too heavy, then it's 2%. Of course, use a mechanical aid to actually help you to carry the weight around. So mechanical aid is important for patient care, where you actually lift the patient using mechanical aid. So the point is, before you do anything, you must think of what you do, think of ways to reduce excessive force. There's thousands of ways to do it, but this what I gave is only some examples. So reduce excessive motion, let the tools do the work for you, all right? And also this also reduce what we call that motion. So you must see whether you can use power tool or not, so that the wrist is a neutral position. So the neutral position will basically reduce excessive motion and reduce outward deviation, and this one will give you Tina tunnel syndrome. All right. Of course, it's better to slide than to just offload, because you also reduce excessive motion. And maintain a neutral posture. So you must understand that our back is basically maintained in an X-curve spine, and keeping neck upright is important for you to reduce neck pain, all right? Or cervical spondylosis, cervical pain, or pain in the cervical region, all right? And of course, we understand that the intra-disc pressure is in relation to different body parts, different movement, different motion. So standing is still the least, standing straight is still the least pressure to your body part. Of course, keeping your elbow and shoulder relaxed, keep your wrist in neutral position. So neutral position is important, all right? So you don't put it in ulnar deviation or radial deviation or extension or flexion. Same for your hand itself. So the neutral, what do you mean by neutral posture? Neutral posture is where both your muscles actually are in the optimum state and they are not contracting too much. So in the optimum state, and that allows it to rest, and that is important for that. So alternative visual display unit arrangement, depending on what you're doing, what you're working on, you need to ensure that how you arrange your desk. So for my perspective, I actually have two monitors in front of me now. So I can look at one monitor, I can look at another monitor to actually look at the data and type on one monitor. So those are the things that you need to focus on. Of course, work in proper height, or at elbow height, sitting or standing. All right, proper use of position support. All right, like if you are standing up, you need to make sure that you move your leg, so you need to have a support for that. All right, even for sitting also is the same support. Keep everything within reach. So depending on what you're working, you must look at primary work zone, secondary work zone, and where you keep your stuff in the primary or secondary work zone. Of course, to minimize static load and fatigue. So when you move, the more you move, the more blood flows. And because of the stagnant blood flows, that actually would be more stressful or increased load to your muscle, and that actually causes fatigue. And for fatigue causes trauma, microtrauma causes over a long period of time will lead to pain. And that is important. Of course, you can reduce force and duration or use foot rest for reposition your leg. And minimize pressure point, contact stress to reduce blood flow and nerve compression. Provide clearance so that there's clearance for the leg, clearance for the head, so that actually you can able to move around, all right, and not just sit static in one position. And of course, provide visual clearance is important. When you're pushing things, you must make sure that there is a clear vision ahead, because that would reduce, you need to turn your neck and reduce the cervical spondylosis. And maintain a comfortable working environment, provide adequate lighting, use of task lighting and when needed, and also avoid glare. Position the light source relative to the VDU, which is basically to reduce direct glare, direct sun, so that you can actually have lights for that, right? So of course, the other one, reduce source of noise. We understand there is a noise exposure guideline that is not in NIOSH or CDC or even Malaysia, where our noise exposure is 85 dBA, all right, for 8 hours. Time weighted average, but those are actually risks for hearing loss. But we are more focusing on ergonomic risk of productivity or psychosocial risk. So noise should be less than 55 dBA. Maintain a comfortable temperature between 23 and 26 degrees Celsius. Maintain good humidity between 30 and 60%. Avoid direct cold air. That will basically make it more comfortable and much more less risky for other psychosocial factor, organization factor, leads to musculoskeletal disorder due to somatic complaint. Move, exercise, and stretch is what I say. No matter whatever you do, if you are sitting down here for 1.5 hours, all right, without moving and stretching, then you would get musculoskeletal disorder or pain. So what are the ergonomic intervention? This is one of the studies that I did on in Cochrane, looking at ergonomic intervention for preventing work-related musculoskeletal disorder of the upper limb and neck among office worker. So we reviewed 15 randomized controlled trial, looking at 2,165 workers, and looking at physical ergonomic intervention, organization ergonomic intervention, training in ergonomic intervention, and multifaceted ergonomic intervention. What we found is that physical ergonomic intervention like arm support and alternative mouse actually reduce the neck and shoulder discomfort, reduce upper limb discomfort. Alternative mouth alone also reduce neck and shoulder discomfort, reduce upper limb discomfort. Arm support alone also reduce neck and shoulder discomfort and right upper limb discomfort. But both actually, having both together reduces discomfort to a much more bigger extent. So when talking about alternative mouse, it's basically we want to use a mouse that will allow you to put neutral position. All right. So the neutral position is the one that we need, and the neutral position is to decrease the pressure on your nerve, decrease the use of your muscle, and that is important. Organization ergonomic intervention like supplementary break is also important. Neck and shoulder up, then reduce neck discomfort, shoulder discomfort, and also right arm pain. So pain. So a break is very simple to what we call that, to implement. A break itself will basically, on top of other things, will allow you to have a much more, will be beneficial to the pain itself. Training in ergonomics, specifically and active ergonomic intervention have been found to be what we call effective, but also multifaceted ergonomic intervention. So this is a study that I done looking at ergonomic intervention for musculoskeletal disorder. All right, 2 RCT. No, this is another. Sorry, this is review that was done looking at 2 RCT physical ergonomic intervention. Participants were randomly assigned 1 or 2 periodontal instruments. This is another study that I done looking at for dental care practitioner. This is for also ergonomic. Also it's a Cochrane review. All right. So multifaceted ergonomic intervention actually helps in to reduce the pain among dental workers. So physical ergonomic intervention and also multifaceted ergonomic intervention reduce the pain, reduce elbow pain, shoulder pain, thigh MST, and also feet MST. I also conducted a active ergonomic training intervention or participatory ergonomic training intervention in a cluster randomized controlled trial, duration of 1 year. So we did a full day course on ergonomic training and computer usage based on the feedback from the workers or participatory feedback from workers. So we did the topic covers the basic ergonomic principle, health issue related to ergonomics, specific work-related upper limb disorder, computer usage, prevention and treatment of upper limb musculoskeletal disorder, compensation, work-related illness, and exercise and computer use. So the intervention group, what we do, we visited individual workplace with the counseling session conducted after 1 month, 30 minutes and 1 hour discussion, adjust the individual computer workstation according to the minimum requirement, ergonomic principle, self-administered checklist of what need to be done, and their own computer workstation. Topics covered include checklists are working posture, sitting, keyboard input, monitor screen, work area, accessories, general information pertaining to organization and participate and practices, compliance with the active ergonomic program was emphasized during the counseling session. So the study actually found that there is a marginal mean decrease in the mean neck score for the left and shoulder pain. So it is important that the intervention was effective at 6 months and at 12 months. All right, so this is for estimate margin of error for elbow pain, also is effective for 6 months and 12 months. So what we need to do, of course, we need to, when we go to work, we need to conduct risk assessment. All right, so Malaysia have a book called the Guideline for Ergonomic Risk Assessment in the Workplace, and this one is produced by our Department of Occupational Safety and Health, Ministry of Human Resources, Malaysia. So one of the things that you need to do when you talk about workplace assessment, you can use tools like RURA or Rapid Upper Limb Assessment. Based on RURA, a survey method for investigating the upper limb. So you look at how much is it, and then you give them points, and then after that you assess the points. By assessing the points, you will get answer. So ergonomic assessment rapid upper limb assessment or ruler will allow you to basically indicates there is a problem and you need to do action immediately. This is just a guideline. This is not, it's validated to understand, but it does not say that because of this your work will lead to musculoskeletal disorder, but your risk of getting musculoskeletal disorder is higher if your RURA score is higher. The same for REBA. This is basically looking at it from, that one is upper limb assessment. This is looking for rapid entire body assessment. So looking for entire body. So this table also provide you how to do it. All right. And the same thing, you give your score, and the higher the score, the higher the risk, and the higher the risk, the probability of getting musculoskeletal disorder is higher. So those are the two tools that you can use when you talk about ergonomic assessment, besides just going to work and looking at the 10 rules of ergonomic, and also reduce musculoskeletal disorder. So use musculoskeletal disorder. But currently there are development in the field of AI or artificial intelligence in occupational safety and health, especially focusing on the aspect that we're talking about, which is ergonomic aspect. All right. So what does AI can do in occupational safety and health? It can do predictive analytics. So using AI to predict occupational health risks and potential injuries. We also can use variable to monitor workers' health and related in related time. Workers' health, to monitor workers' health in real time. Also, we can use for medical surveillance or diagnosis using AI to classify X-ray for pneumoconiosis, or telemedicine to a remote diagnosis and consultation, or to handle a large data set for epidemiological research. But look at it from the perspective of real-time motion and tracking and analysis. Actually, they can use computer vision or post-estimation technologies, conversion of 2D video to 3D skeletal model. So they do the real-time assessment using the same aspect of ruler or REBA, and these tools can actually help you to come up with a quick and easy way of assessing the workers to provide you with the real time of what are the risk factors for each of the body part. These are tools available currently, looking at the movement, and then they can give you an estimate. So you can use this along with your expertise to go in and assess whether these tools are what we call that, functional or not. So looking at that perspective. Of course, AI-powered wearable devices also has been found to be useful. These are just in the infancy stage, like wearables that look at it from the initial variable inertial measurement unit, IMU, which is basically to see how much you move, so that basically it can give you a warning on whether there is extra risk or not in the context. So the integrated initial measurement unit or psychological sensor for biosensor for health monitoring also can be used. Exoskeletal is also another up and coming technology where you can actually wear an exoskeleton to actually help you to lift and help you to improve your ergonomic lifting and carrying. That means you can actually assist you to carry heavier weight without you having to have strain to that. Summary, my final slide. What MSD, what related musculoskeletal is common. Low back pain and neck, no back pain, neck pain are highest, offer the highest disability. Multi-site musculoskeletal disorder is more common than a single-site musculoskeletal disorder. Risk factor, individual factor, workplace site, physical factor, organizational factor, and psychosocial factor. Identification and control of those risk factors is important for managing work-related musculoskeletal disorder. Thank you very much, and I'm open to question and discussion.
Okay, thank you very much. So all of you have already listened to the presentation and also watched some of the slides from Professor Victor. Would you like to have some question? If you don't want to ask about in bahasa in English, you can also ask in bahasa Indonesia. If Prof. Victor meet difficulties in understanding your bahasa Indonesia, I will try to help you. Thank you.
No worries.
Okay,
Yeah.
please.
Please. Just turn on your mic and you can start ask question. You can ask in bahasa Indonesia if you're not comfortable in English. No problem.
Oh, that's great. Okay. Silahkan semuanya. Hello.
Hello.
Oke. Oke, silakan. Sudah di-set untuk semua bisa unmute sendiri? Silakan.
Sudah Ibu.
Oke. Silakan siapa yang ingin bertanya, silakan langsung. Oke. Salwa, silakan Salwa. Coba
Oke.
jangan dipin layarnya di galeri lagi. Nggak usah ngepin layar lagi, discussion sessionnya jangan dipin. Oke. Ya, good.
Okay, good afternoon, Professor Victor and Professor Hanifa. Before that, I apologize if my camera cannot be turned on for some reason. And before I start asking, I would like to introduce myself. My name is Salsa Sabila, a student of Occupational Safety and Health at Diponegoro University. So I really enjoy our discussion today, and I think today's topic is very relevant into our field of study as an occupational safety and health students. So we understand that musculoskeletal disorders are one of the most significant occupational health challenges in the workplace. So what I want to ask is, if we later become a safety officer, how do we place the role and also maximize employee involvement to synergize in forming an effective safety culture for the prevention of WMSDs? And what strategies can we apply to optimize the relationship between we as the safety officer and the employee? So that's all my question. Thank you so much, Professor.
Thank you very much, Salwa. Terima kasih. I think your question is very, very deep question. What role can you play to ensure the safety and health of your workplace? I think first thing you need to do, you need to understand your workplace. When you start work, you need to understand your workplace. And the best thing to do is to look at data. All right. Look at the number of people with having musculoskeletal disorder. If you want to tackle musculoskeletal disorder, but more then after that, you also need to do risk workplace survey or risk assessment in your workplace to identify area of high risk to musculoskeletal disorder. So to prevent musculoskeletal disorder, as I mentioned, is not just on physical workload, but also on psychosocial workload. So psychosocial workload is also important component. So the only way to prevent and to ensure that musculoskeletal disorder is taken into consideration is to look at the whole work process of your workers, and that is not easy, I know, for a fresh safety and health officer. So for a fresh safety and health officer, the best thing to do is to review the standard operating procedure, the SOP, and also see whether there is other factors that can actually affect the musculoskeletal disorder or not. I think it's a very loaded question. It is not easy to answer. Is there anything else you want to ask, Selva?
That's all, Professor. Yeah, that's already answered my question. Thank you so much for your perspective.
Thank you for your question. It's very, 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 very tough question to answer. All right.
Ya, silakan. Siapa lagi? Boleh bertanya dalam bahasa Indonesia, boleh bertanya dalam bahasa Inggris.
Iya, dua bahasa ini boleh paham.
Bisa paham,
Bisa
dipahami.
Bisa difahami.
Oke, silakan siapa lagi? Terima kasih. Salsa tadi sudah terjawab ya.
Terima kasih kembali, Profesor.
Okay. Silakan, siapa lagi yang mau bertanya tidak harus berbahasa Inggris? Halo?
Hello, yes. Wow, panjangnya.
Ah, Joselina. Okay, Prof. Victor, there is a chat that you might can just directly answer to this question on the chat box.
Okay, so the question is basically preventing musculoskeletal disorder in the informal sector
Mhm.
can be challenging as workers in this sector often lack adequate access to ergonomic equipment and workplace safety facilities, unlike the informal sector. Could you share some low-cost or accessible practice that smaller organization companies with budget constraint can implement to prevent musculoskeletal disorder? First thing is that to prevent musculoskeletal disorder is not expensive, all right? You don't have to buy expensive ergonomic equipment. You don't have to use the AI tools that actually I mentioned just now. The AI tool is just for you to think about it, that these tools are available. But if you look at my 10 ergonomic principle for preventing musculoskeletal disorder, all the 10 principles of preventing musculoskeletal disorder can be implemented without expensive ergonomic equipment. What you need to do is you need to ensure that the workers working in a safe position, the tools that they use are basically, if you tools that don't have grip, you can actually put a rubber grip which you can buy from a shop that actually would allow you to actually design that. So for a workers from informal sector, if you can use the 10 principle of ergonomic, and that is important, that's just already able to address the problem. So the main thing is how are we going to able to teach them to use the tools? And that is where you come in. You as a safety and health officer, if you think that you want to work for a smaller company and you want to give them free services, you can give them free services and then you can train them up to look at it, that's why you must be looking at it from basic principle, which is, if you look at even the active ergonomic intervention that I mentioned, it is from discussing with the worker, identifying the risk, and then implementing it. So it don't have to be expensive, but it is sometimes it's time consuming, and that is what you can actually come in and actually address. It's a very good question. Thank you very much, because I think it is important for you to understand that. But if you look at the principle number 10 is simple. You got to break your task down into smaller area and you rest. Even the systematic review identify that rest time is, you can actually improve your reduce work-related musculoskeletal disorder. So the 10 principle or ergonomic principle is simple to use and to understand, and I think that would allow people to be much more clear. or Jocelyn. Oh, the next one is Cleo, Kaiser, Cleo, Intana. Okay. From Public Health, Diponegoro University. I want to ask something about MST prevention. Okay, many companies focus on MST prevention primarily through equipment and workplace adjustment. In your view, what roles does employee education plays in preventing MST, and how can companies make sure that training program resonates with employee leads to long-term behavior change? I think this question is the same as before. The one thing is that if you talk about equipment itself, equipment does not improve your what we call that, your MST. To improve MST, to reduce MST in the workplace, you need training, and the training itself, you need to basically understand what the worker needs and what the worker wants, understand the workplace. That's why the two types of training that I discussed just now. One is called participatory agronomic intervention. Participatory means that the workers participate and identify the agronomic risk. So when the workers identify agronomic risk or understand the agronomic risk, it becomes their own. It becomes your own. So you won't do it. You see, if you tell the workers that this is wrong, the worker won't know. You must let the workers say that this is wrong, and then they would basically practice what they do. So that's how you change behavior. By changing behavior, you're not telling them this is wrong. And if you tell young people that this is wrong, they would do it because they want to do wrong things, because that's what they want to do. But you must tell them, you must show them that they must be able to identify what is wrong, and they must be able to change their behavior based on what to do. So all those things are important. Of course, when you talk about agronomic intervention or any kind of intervention, you also look at it from the perspective of the workers itself. How much of those intervention actually are going to reduce your productivity? That means it's going to make you need to work longer, need to make you work longer time to complete your task. And that actually will prevent people from doing it, because some of the workplace, they are what we call paid by piecemeal. That means if you finish one job, I will pay you. If you don't finish the job, I won't pay you. So if I do more job in shorter time, I get more pay. So that is also something that the company needs to look at. If you want to reduce musculoskeletal disorder, and you say I pay by piecemeal, and ask them to do all those things that are going to slow me down, then it becomes a problem. But you can still do that by increasing the productivity, by redesigning the workplace so that reducing stress, but also increasing productivity, increasing able to produce more. So all those things could come hand in hand. If not, the workers would not change, because what I get is based on how much I produce. If I don't produce enough, I won't get paid, and then I cannot feed my family. So that is important for you as a safety and health officer to think about from the perspective, not just on physically, but on psychosocially, also on social aspect of the worker. Thank you. You understand what I'm saying? Or am I saying a little bit too quickly?
Ya, silakan yang bertanya tadi bisa mengatakan sudah paham atau belum. Kezia bisa open mic, so
Okay,
silakan.
great. So now they are basically just typing. They don't want to open the mic. They don't want to talk. So I congratulate Salisa Salsabila. You are so brave. Your English is so good.
Thank you, Professor.
Yeah, see, you're so brave and your English is so good. All right, continue. You continue to do what you are doing. All right. Anyone else want to open the mic and start talking? You, as mentioned by Prof. Hanifa, you can talk in Indonesia. Bisa.
Ayo, silahkan, jangan malu. Ayo, nggak boleh malu ya.
Yeah.
Excuse me, sir, can I ask a question?
Boleh,
Wow,
boleh, boleh.
silakan Arkan.
Okay, let me introduce myself first. Professor Victor, my name is Arkan Palvidharma from Occupational Safety and Health Diponegoro University. My question is there any case when ergonomic equipment have been given to informal workers, but they don't use it? Like, what are the main reasons? Like, it's cultural norms, perceived practicality, lack of training, or mistrust are some of the reasons why this happens. How can businesses and organizations fix this problem so that they adopt it right away and stay on track? That's my question. Thank you.
I think the term ergonomic equipment, you should not actually use the word ergonomic equipment. All right, because when you use the word ergonomic equipment, that means the equipment, there's no such thing as ergonomic equipment, because as ergonomic means that the it is based on the worker itself, based on the work task itself. All right. So if you just introduce ergonomic equipment into a company, into a workplace, without understanding whether the equipment itself can assist or can help the worker to actually do the work, that is where the issue arise. So when you want to introduce any intervention, you must understand whether the intervention will help or will disrupt the work. So it's not just, that's why it's important when as a employer, when you introduce something, you need to understand whether the workers would understand what you're giving them. That's why you need to ask the workers, need to talk to the workers, and need to tell the workers this is what it is for, and then see whether the workers actually benefit from those equipment or not. It's not about not about equipment, Equipment itself would not reduce musculoskeletal disorder. As I mentioned, musculoskeletal disorder is not just physical risk, but also psychosocial risk. How you work, what kind of rest you take. So I understand from your perspective is that you want to blame the worker from not using it. It's not the worker not using it. It's the worker don't understand why I need to use it. How by using it I can improve my work. So you must also focus from the worker's perspective. You cannot say, okay, from a safety perspective, I want it to be safe. But from the worker's perspective, it's very simple. Safety is important, but money in my pocket is more important. Getting money home is more important. Safety is not so important if I cannot get money home. If you say, okay, I give you the same money, but you do this with this equipment, but if you cannot reach your target, I still give you the same money, then I will use it. But you don't. But the problem is a lot of time they don't. They okay because you use the equipment a little bit slower, and that's where the problem arises. So understanding the need of the worker. There's a lot of time we don't understand the need of the worker, what the worker really need. All right. Then only we say, okay, how can we improve on your safety and health, reduce your MSD based on that. Of course, if you introduce something to someone who already have MSD, that's different. But you introduce something to someone who don't have MSD, but they slow their work down, then they won't use it. The equipment that you introduce must make sure that it improve their work, not just slow their work down. So equipment itself is not important, but the whole thing, not just equipment. All right. So I hope I answer your question, Arkana.
Okay, thank you for the answer, Professor.
Ada lagi? Ada lagi? Satu penanya lagi. Ada lagi? Ayo, satu, dua boleh.
Boleh,
Silakan.
Tak ada masalah.
Boleh ya, tidak ada masalah. Tidak masalah. Ayo,
Tidak
siapa?
bermasalah.
Bahasa Indonesia atau mau nyoba bahasa Melayu juga boleh.
Bahasa
Ayo
Melayu
silakan.
boleh, bahasa Indonesia sikit-sikit, Pak.
Sikit-sikit boleh. Oke, ayo buka kamera juga sekalian kenalan dengan Prof. Victor loh, gitu yuk. Oke, ada lagi yang akan bertanya? Oh, ada. Amalia Hairanisa. Silakan Amalia, open your mic and camera if possible.
Okay. Thank you, Prof, for the opportunity. I would like to introduce myself first. My name is Amalia Heranisa from Public Health Diponegoro University. I want to ask something about implementing ergonomic solutions. My questions is implementing ergonomic solution is often discussed as a key strategy to prevent MSDS. Could you provide some insight into how organizations can identify and implement effective ergonomic practice, especially in diverse settings such as office environments, factories, and field work? Thank you, Prof.
All right. So if you look at industry perspective, from an industry's perspective, all right, especially if you look at bigger industry, the important thing is that when you go and see those industry, they have already ergonomic practices there already. They have actually implemented ergonomic practices, but also the other problem is that they also have what we call the factory. If the factory have already been built, all right, then what the factory is designed to do most of the time is not to design to fit the person, but to design to what we call to ensure the line actually flows faster, the process actually are much more faster. So for any company that want to introduce ergonomic intervention or want to look at from ergonomic perspective, then the first thing that anybody needs to do is to do risk assessment. You need to go down and identify the risk. And also before you do risk assessment, you must understand that because the workplace design itself might be designed, let's say you buy a machine from Europe, all right, from Europe. Let's say you buy a machine from Europe. Let's say it's a second-hand machine from Europe. You import it into Indonesia. I say, okay, all the workers in Indonesia must work to do it. But you must understand, a machine designed in Europe does not fit the workers in Indonesia because the workers in Europe are much more taller. Their hands are much bigger. So for that purpose, you must redesign the workplace for your Indonesian population. Same thing like you want to buy a chair, correct? You want to buy a chair, a second-hand chair or chair from Europe, you're coming in here, it cannot fit you. I always ask a very important question, all right? If you go and see your bosses, correct? Your bosses have the biggest chair. Boss actually have a big chair. But the problem, if you look at the big chair, it's not ergonomic. The chair is big because the boss is big, so he needs a big chair. But it's not ergonomic. Have you just go and see all your bosses have very big chair, very nice chair, wooden chair, no, but it's not ergonomic. So it is that perspective that you need to consider when you go down to talk to people. You must understand that it's important for you to understand your workplace and make sure that you understand your worker. As I mentioned, your workers, some people are not trained, Let's say you do a machine, all right? A machine that give you certain information, but the workers are not trained to actually act on those information. That also will lead to ergonomic problem. If the worker is not trained to use a knob, that also leads to ergonomic problem. Right? And that is important. That's why training is important. Understanding your worker is important, and that actually would allow you to focus on. So understanding your workplace is important. Understanding the worker is important. So that means if you have changed your worker, let's say you change your worker from all male to female, also a problem. Let's say you used to have male, used to have female only, but now you have male worker, also is a problem because the workplace are not designed for that. All right. Let's say you hire male workers and female workers because their hand size are different, their dexterity are different, how they manage things is different. That's why you need to be able to look at it from the perspective of whether you design it for certain size, certain female. That's why when you look at, especially for airline, all right, airline industry, all right, to become an air hoster, to become a what you call that in Indonesia is called pramugari, is it? Yeah. you need to have certain height, you need to have certain stature, certain height because you need to reach the thing above, all right? Right, and you need to be small because you need to walk between the aisles. So if you have a big fellow with short, it cannot work. You see, those are because we cannot change the workplace, so you got to change the worker. So those are the things you must understand. No? If you have workplace that's why certain criteria is not because we are what we call biased. We are not culturally sensitive, but because we want to prevent accident, we want to prevent occupational diseases. That's why we design the place. That's why we say certain workers can work here, certain workers cannot, because the workplace is not designed to change. If you want to change the workplace, then another worker come in, it will be risk for the other worker also. So that is the thing you need to understand. So ergonomic is basically individualized work. That's why, but if you want to make it much more global, then you need to set a certain standard. What height, all right, how big, so that you can actually fit the person inside the box that you have created. Thank you very much, Amelia. Amalia.
Okay, thank you, Prof, for very interesting answer, and this can be my maybe new reference regarding ergonomic implementation solution that should be done. Once again, thank you very much, Prof Victor.
Thank you.
Oke, masih ada waktu, silakan. Silakan. Siapa lagi? Makin hilarious, makin banyak humor. Ternyata ergonomik itu kalau kita diskusikan menjadi lebih humoris ya. Tadi paling berkesan adalah kursi bos, kemudian pramugari. Ayo siapa lagi yang mau bertanya silahkan. Karena ini sangat relate dengan kehidupan sehari-hari ya.
Ya, betul. Semua relate dengan kehidupan sehari-hari.
Iya. Fortunately sekarang banyak, kalau mobil Jepang itu sangat enak ya. Kalau pakai Nissan X-Trail, pakai tapi kalau mobil European jadi nggak enak ya, Prof ya.
Betul.
Karena kan
Yeah. So
karena
the main thing is, kalau whatever you do, you must understand your population, understand your worker. If you don't understand them on three perspectives, on the physical perspective, psychosocial perspective, and also organization. Yeah.
perspektif.
Yeah.
Berarti ini untuk mahasiswa nanti kalau yang berbakat entrepreneurship bisa sebagai landasan bahwa market yang akan kalian tuju akan berbeda juga. Karena tidak semua mereka bekerja, Prof.
Betul.
Jadi ada yang juga memproduksi peralatan-peralatan yang bisa memenuhi postur tubuh di mana target population kita jual di Indonesia gitu.
Betul. But if you become an entrepreneur and you want to produce equipment, then you must understand your worker, and understand the process that you're going to do. Right. The main thing is that whatever equipment you produce, you must make sure that it is not just ergonomically designed, but also it improve productivity. So the focus is productivity, not ergonomic design. By using ergonomic design, you improve productivity, and that is what people buy your equipment.
Oke, so ada lagi ilmu baru. Jadi untuk entrepreneurship, untuk pemilihan produk nanti kalau kalian sebagai HSE officer itu selalu dalam procurement akan dilibatkan, ya toh? Nah, jadi ada tadi dari Prof Victor mengatakan tidak hanya sekedar ergonomi, tetapi outputnya juga harus produktif. Untuk produktif, peningkatan productivity gitu. Bagaimana, ada yang tertarik untuk bertanya lagi? Silakan loh. Masih ada waktu. Please, don't hesitate if you want to ask question in English or you can just ask in bahasa Indonesia. Silakan. Halo. Siapa yang akan bertanya lagi? Halo, halo. Halo mahasiswa K3, FKM Undip, siapa lagi? Boleh semuanya. MC, bagaimana MC? Nah, sekarang bagaimana kalau nanti ada pertanyaan dari Prof. Victor gimana nanti? Apa yang mahasiswa akan lakukan gitu
Iya, betul.
kalau menghadapi kuliah yang panjang? Tadi Prof. Victor saya mengajar 4 SKS, otomatis 4 jam pelajaran.
Ya,
Jadi
betul.
di sela-sela penjelasan, kemudian kita membuat group work. Jadi kita atur layout kursinya tidak menghadap ke depan, tetapi dalam grup-grup. Kemudian kita selingi juga dengan stretching. Kemudian ada pemutaran video untuk menggambarkan hal-hal yang lucu, tetapi bisa menggambarkan apa yang menjadi permasalahan kita. Dan salah satunya adalah MSD karena ternyata kita belum mampu semuanya untuk membuat ruang kuliah itu kursi dan meja semuanya. Sehingga banyak sekali kursi dan meja lipat. Itu akan sangat kesulitan bagi yang posturnya tinggi atau besar gitu. Sehingga nanti kemungkinan kita juga akan membuat semacam policy brief untuk rekomendasi bahwa ada mahasiswa yang juga ukurannya juga seperti European people gitu. Memang tidak semuanya memang sama gitu. Kami juga baru merasakan ketika jumlah credit hours-nya itu melebihi 2 credit hours, itu challenging banget gitu. Sama dengan sore ini, apakah masih ada yang akan bertanya? Karena nanti Prof. Victor, kalau memang masih ada, akan ditunggu. Gimana? Oh, Abiyu. Nah, ini dia. Halo Abiyu. Sore ini silahkan Abiyu boleh open kamera, boleh. Oke, oke, silakan Abiyu.
Hello, Prof. Hold on. It seems like my background is wrong for some reason.
No worries, no worries. The background is not important.
Okay.
Tidak
I'm going to
apa-apa,
ask my
tidak apa-apa.
question first, then I'm gonna fix my background. Prof, allow me to ask a question about the ease of access for these measures that you have put in place. Because there is lots of places where you cannot easily move your body, especially after a few hours of doing something. Like for once, I have been to a workshop where it's not possible for us to move after we have first seated down because of the minimum amount of space between people. How do you propose to fix that problem, Prof?
Well, they're simple. You just have a bigger space. That means the first thing is that your workshop itself have not been designed to fit the people. So you must understand okay, not just fit the people. You see, the room itself, a room that is designed to fit how many people, and for that reason, not just about ergonomic, it's about airflow, which is a different topic here. You see, you must understand that if a room is too small or crowded, the airflow within the room, the amount of oxygen that you need would decrease because it's too crowded. All right, for that purpose itself. That's why you need to what, if especially in the workshop where you need to move. All right. So if your space is not enough, then then the workshop need to go elsewhere. The best thing if you are in a workshop and you cannot move anywhere, the best thing is to go walk outside and go to the toilet and come back. So I think that is the thing. But there shouldn't, if a workshop if you cannot move, that become a problem. I understand what is your question, is that if you cannot have a place to move, what are you going to do? But moving is the most simple and cheap method for you to actually implement.
Okay, I see.
Yeah. All right. I mean I understand what you say. If you cannot do it, how are you going to do it? But it is the thing that you need to do anyway. Thank you very much. Any other question?
I think that covers my question. Oh, one more thing, Prof. I have a question about the minimum space someone should be using, or like if an event is happening, like how much space should a person get ideally?
Depends on how big you are. So when you talk about space, depends on how big you are. That means you can actually move around. All right. So of course you cannot be shoulder to shoulder. So there should be a space for you to stretch and move around. So also depends on your activities itself. So all those things must take into consideration. So the minimum space required for a person, it depends on the activities, but it should be enough space for you to move your arms around and during that period of time, right? Okay.
Okay. Thank
So
you very much.
there's no measurement. Of course, there is a measurement for the minimum space for a living space under the WHO, which is 10 feet times 10 feet times 10 feet. There is your living space for what we call for a household. So that's under WHO, but it's not for occupational practice. Occupational practice is that the space you have must be big enough for you to be able to move around. All right. So you cannot be sitting there without being able to move, right? Yeah, see, like Prof. Anipal is moving. I'm also moving. Stretching, moving, Yeah, so that is the thing. So when you design, you must be able to design it on that context. Same thing, like, but when you talk about safety per se, all right. Fire safety is an important component also, but this is not under the topic. So if you design a space that people cannot actually egress or cannot go out in the time that is required, that also is wrong. All right. So for airplane, it is designed for people to evacuate within 2 minutes. All right. Everybody must get up within 2 minutes, which is very quick. All right. So that's why they ask you to remember why they ask you to put up your chair. All right. Put in your table. That one is not because of safety reason. That one because of fire evacuation. You want to evacuate. If your table is down and your chair is up, then the people behind you cannot move out. So you put up your chair, put up your table, so you can actually move out quickly. So those are for safety reason. If you understand the safety, right? So a space itself is not just for ergonomic, but also for safety reason. Evacuation is the most important, especially fire hazard. So a lot of people die because of fire. Remember the or for disaster. Remember the fire disaster in Bangladesh, all right? Because people cannot escape because the place is too crowded. Okay.
Okay. Thank you, Prof.
Yeah.
So look at the fire safety requirement of your country. Each country have different fire safety requirement, and that is important when you design a workplace. How many people you can fit into a space? Okay, thank you.
Yes, very important.
Thank you very much, Prof.
Okay, Abiyu. I think it's very important for us to really advocate public agency when they make a meeting room and etc. They forget about the importance of aisle. So I try to also be an advocate that the seats is no more than 4. Mean 4 is if there is something, then 2 could be evacuated from this aisle, and then the rest of 2 would be evacuated from the left aisle. So, however, it is very difficult to find the standardized sitting room in the public areas.
Yes,
I
true,
think
correct,
this is
true.
very important, and
Yes.
Abiyu has also raised this kind of issue. Thank you, Abiu.
Yeah, if you see
Okay.
how the airplane how the airplane is designed and how the
Yeah.
when you go to a ship, how it's designed, is for
Mhm.
evacuation.
And also for the movie, the cinema, they have no
Yes,
such kind of
cinema is
it's
different.
rich.
Cinema is not so not it's, because it's not at high as higher as high risk as a ship or a airplane.
I see. Yeah. And what about the economic syndrome of airplane is also another issue, right?
Yes, that one is different. That one is for that's why the simple thing is to move around, correct?
Move.
Yes, move. Yes.
Yeah, the economic syndrome is like
But no problem. But you want to cheap flight, then you have to move around, move.
okay.
So item number 10, economic principle number 10 is move, stretch. That's the only
Move.
thing you need to do, to prevent economic injury.
Okay.
Okay, thank you.
Thank you. Ada lagi yang mau bertanya? So I think it's time for us to really summarize this discussion. Is it okay?
Thank you very much.
Okay, so here I try to summarize our discussion and let me share. If there is a point to be added, please add to this summary. So Prof. Victor this afternoon has emphasized the significant burden of musculoskeletal disorder in Indonesia and Malaysia, shedding light also on their impact on workers' health, productivity, and quality of life. And then also he underscores that the cause of MSDs are multifactorial, influenced by both workplace conditions and external factors, necessitating a holistic approach to preventions and management. Key strategies for managing MSDs include ergonomic interventions that address physical, cognitive, and organizational factors, with a focus on reducing repetitive motion, maintaining neutral posture, and utilizing mechanical aids. He also discussed the importance of creating optimal work environments through a combination of physical modifications, policy change, and exercise as preventive measures. And addressing challenges like MSD prevention in the informal sector or companies with budget constraints, Prof. Victor's advocated for low-cost yet effective practices such as engaging workers in discussion about ergonomics, implementing small changes, and evaluating their effectiveness. Additionally, he highlights the critical role of employee education and long-term MSD preventions, emphasizing the need for training programs that resonate with workers and encourage proper work behavior. And multifaceted interventions combining physical adjustments, organizational strategies, and active participations from both employers and employees were presented as essential for creating sustainable ergonomic solution. Thank you very much.
Very, very nicely summarized. Thank you very much, Prof. Hanafi. It's very, very nicely summarized, and I think I cannot do it much better than that. All right.
Okay, thank you very much. It's because your talk is also amazing, so it's just try to write down whatever
Great. Yeah.
I catch up.
Yes. Good. Right.
Thank you. And I will send also the summary in our email because this is part of our, what we call it, ongoing communication in terms of this guest lecture as one of our KPI.
Thank you very much. Yes.
Okay, so now is your closing remarks with regard to these sessions.
All right. Thank you. Prof. Hanifa, and thank you, everybody who is here today, who has contributed to not just the questions, but also participated in this event. I just hope that whatever I share today will be useful to you in your career, and you will be able to practice it and understand it. All right. The main thing, the first thing, as Prof. Hanifa mentioned, is that you need to ensure that the workers understand why you do intervention, and the intervention should not be able to disrupt their workflow or disrupt their work itself. So the intervention should help them improve work, not disrupt their work. And that is an important component that I think all of you need to take back and understand that all of you have some preconception idea what you want to do. And I hope the best for you, and hope that you succeed, all of you will succeed successful in your career and in your life. So thank you very much.
Wow, such amazing wishes and also very best closing remark. And we all are grateful for your availability of time and also efforts also. And hopefully in the future, we still have the upcoming International Congress on Public Health and Tropical Coastal Developments also. We also would like also to invite you to be part of our biennial international conference.
Thank you
For
very
the
much.
next year.
Thank you very
Hopefully for the next communication. If not me, then my fellow colleagues will be approaching you again. Thank you very much.
Thank you very much. Yes, thank you
Okay.
for the kind thoughts.
Okay, thank you. So is there any closing remark from all? Oh, there is one more agenda. We would like to also provide you with our certificates of appreciation.
Thank you.
And okay, please. And I would like to hand over all this session to the master of ceremony. Thank you.
Okay, thank you.
Okay, thank you very much to Professor Dr. Victor Hoci Y. bin Abdullah for the insightful discussion, and to Professor Hanifa for leading our discussion for today. It was really fun and insightful. Next, we'll have the virtual presentation of certificates to the speaker, to Professor Dr. Victor Hoci Y. bin Abdullah by our moderator, Professor Hanifa Mahardani, SKM, MPH, PhD. Okay, to the committee member in charge, please proceed. Okay, may I help to lead the documentation in my count? 1, 2, 3. Okay, the next pose is zero accident pose. In my count, 1, 2, 3. Okay. Okay, thank you very much for the committee. Okay, next we'll have the virtual presentation of certificates to our moderator, Professor Hanifa Mahardani, SKM, MPH, PhD. To the committee member in charge, please proceed.
Thank you very much.
Okay, may I lead the documentation in my count? 1, 2, 3. Okay, the next is zero accident pose. In my count, 1, 2, 3. Okay. Okay, guys, thank you very much. Time flies so fast. We've learned so many new things from today's guest lecture. I'd like to thank to our speaker and moderator for the insightful discussion. And of course, thank you to all participants for your question and enthusiasm. The certificate presentation has complete. Before you leave, please take a moment to fill out the attendance link via QR code that will be displayed on the screen or via link in the chat section. And to Professor Dr. Victor, if you have any agendas or activities, you may leave this Zoom meeting. Thank you, Professor.
Thank you very much. Thank you, everybody. Thank you for having me. Thank you, Prof. Hanifa. Thank you, Maria,
Thank
for
you. Thank you,
being an excellent
Prof.
MC. All right.
Okay.
Thank you. Thank you, all the
Okay.
participants, for asking the interesting question. I think
Yeah.
hopefully everything will be good for you. Thank you. Bye-bye.
Okay, we will be sending the email. Oke, terima kasih ya.
Yang memerah darah, yang memutih tulang, kerinduan untuk Indonesia tempatku berpulang. Sejarah mengakar sejak saya lahir. Semangat yang tak akan lekang hingga
Pusaka abadi nan jaya, Indonesia sejak dulu kala tetap dipuja-puja bangsa. Di sana tempat lahir dibuai dibesarkan bunda, tempat berlindung di hari tua, sampai akhir menutup karya indah Tuhan Maha Kuasa bagi bangsa yang memujanya. Di sana tempat lahir beta, dibuai dibesarkan bunda, tempat berlindung di hari tua, sampai akhir menutup mata, sampai akhir menutup.
Okay, we finally reached the end of our event. We express our gratitude to Professor Hanifa Mahardeni, SKM, MPH, PhD, as the moderator, and Professor Dr. Victor Ho Chi Wai bin Abdullah as the speaker for their willingness to participate in this guest lecture. We also thank all participants who have attended. On behalf of the committee, I apologize for any shortcomings or mistake, intentional or unintentional, during the event. I, Maria Diva, as the Master of Ceremonies, bid you farewell. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Wish you have a great day. Goodbye.
Halo Getsa. Halo Getsa dan kawan-kawan, mahasiswa kelas K3, kelas apa ya? K31B ya? Yang kuliah sore ini ya? Halo, Getsa? Oh ya, Prodi S1 K3 1B mana ya? Halo? Kita akan lanjut kuliah ya lewat Zoom ya. Zoom-nya Zoom ini loh. Oke, halo. Adakah semua mahasiswa K3 Prodi K31B masih ada di sini?
Ada, Prof.
Sebentar, Bu. Lagi dipanggilin sebentar lagi.
Halo, masih ada ya?
Masih, Bu. Saya
Oke.
Ibu.
Jadi Bunda akan share screen lanjutan untuk tadi itu sudah. Oh oke, tadi kita sudah berbicara sebetulnya itu bagian dari materi besok tentang isu kesehatan masyarakat. Nah, hari ini kita akan berbicara tentang kalian boleh kuliah sambil tiduran, sambil minum, sambil makan ya, nggak usah pusing, relaks saja karena kita memang harus menyelesaikan sampai jam 4.20. Apakah betul? Anda juga boleh open mic semua kok. Oh gitu. Oh iya iya.
Baik, Bu.
Berarti lanjut Zoom apa?
Sibuk dia kayaknya. Abi kamu kepanjang. Abi kamu kepanjang.
Isu tadi tentang kuliahnya dari Prof. Victor. Kalau tadi ada risk assessment ya, kalau Bunda akan Oke, jadi sekarang kita akan membahas tentang risk assessment dan menyambung apa yang disampaikan oleh Prof. Victor tadi. Apakah semuanya masih apakah semua sudah mempunyai slide ini? Tadi ini terkait dengan tadi bahasan dari penilaian resiko. Kalau tadi Prof. Victor menyebutkan tentang risiko musculoskeletal disorder ya. Nah, di sini penilaian risiko yang akan kita bahas itu banyak sekali di samping tadi salah satunya adalah musculoskeletal disorder. Nah, kalau musculoskeletal disorder tadi merupakan risiko dari apa kalau Prof. Victor tadi, ayo? Risiko dari tempat kerja, dari peralatan kerja, dan dari lingkungan kerja. Apa yang menjadi concern? Karena musculoskeletal disorder tadi bisa menyebabkan produktivitas turun dan juga penurunan kualitas hidup. Nah, langkah-langkahnya tadi juga disebutkan ada identifikasi, kemudian ada penilaian, prioritisasi risiko, kemudian rencana pengendalian risiko, kemudian implementasi tindakan pengendalian. Tadi itu dikatakan implementasi untuk mengendalikan MSD pada sektor informal itu bagaimana gitu ya. Ternyata harus melibatkan pekerja. Kemudian ada pemantauan dan peninjauan berkala gitu. Nah, kemudian tadi juga disebutkan banyak sekali Internet of Things, cyber dan sebagainya ya, sehingga teknologi dalam menilai risiko tadi antara lain menggunakan Internet of Things, menggunakan cyber physical system, kemudian personal protective equipment. Juga sensor real time monitoring, yaitu memantau waktu secara saat itu juga dan nyata gitu. Nah, kemudian dalam pendekatan personal dan dinamis dalam K3 ada paradigma baru yaitu real time risk assessment. Tadi kalau tadi itu contohnya adalah di risk assessment ergonomi kemudian musculoskeletal disease. Nah, penilaian risiko tadi itu lebih kepada individu. Contoh tadi yang paling hilarious apa yang paling lucu? Adalah contoh dari kursi bos yang besar. Kursi bos yang besar itu bukan ukurannya, karena itu ukurannya orang Eropa. Misalnya Bunda kalau duduk kursinya besar, berarti nekuknya harus gantung gitu, sehingga nggak cocok. Maka penilaian tadi tidak bisa dipakai untuk kolektif karena ukuran-ukuran individu di Asia itu berbeda dengan Eropa. Kemudian ada penerapan lingkungan yang cerdas atau smart work environment. Nah, bahan-bahan tadi nanti akan dikirim ke kalian juga. Nah, kemudian untuk alat dan teknologi smart PPE itu memakai pelindung dengan sensor suhu tubuh dan lingkungan. Kemudian tadi ada teknologi GPS untuk pelacakan pekerja di area beresiko tinggi. Kemudian aplikasi My Fitness Pal, Fitbit untuk memonitor asupan kalori harian serta rutinitas aktivitas fisik dan pola tidur yang diperlukan. Kemudian contoh alat tentang Google Fit itu memberikan informasi tentang jumlah langkah yang diambil sehari-hari, detak jantung, serta menetapkan tujuan aktivitas fisik yang harus dipakai. Kemudian juga ada lagi loh untuk menjaga kita supaya tidak terkena bahaya akibat kehujanan. Maka gunakan aplikasi EQ Weather, kemudian yang bisa digunakan untuk misalnya kalian naik sepeda motor nggak pakai jas hujan. Jadi kayak kemarin sore itu berlomba-lomba setelah hujan itu berlomba-lomba mencari tempat berteduh. Kalau itu untuk memakai apa? Untuk memakai jas hujan. Coba kalau dalam jumlah yang besar mencari tempat berteduh, artinya praktek naik sepeda motor itu tidak aman. Coba gunakan, kalau hari ini akan ada hujan rintik-rintik jam 3 sampai jam 8 malam. Kita lihat di situ berarti pada saat itu, pada jam itu, Anda harus memakai jas hujan yang tidak harus mencari tempat berteduh, tetapi mudah dijangkau gitu. Nah, ada lagi manfaat teknologi K3 di tempat kerja tadi. Kalau tadi manfaat analisis musculoskeletal disorder. Tadi bisa ada rula, ada reba. Namun di sini sekarang kita juga ada metode pemantauan yang dimana itu bisa dipakai oleh pekerja. Kemudian ada peringatan dini terhadap bahaya. Tadi sudah disinggung oleh Prof. Victor tentang bagaimana mencegah ketika terjadi kebakaran. Jadi di situ Anda harus memikirkan kalau terjadi kebakaran seperti apa yang harus dilakukan. Kemudian peningkatan efisiensi dan keamanan operasional. Nah, sekarang kalau kalian semua ditanya sebetulnya tantangan implementasi dengan adanya teknologi K3 itu apa gitu. Pasti nanti di perusahaan Anda akan menemui orang yang mengatakan kompleksitas sistem. Interoperabilitasnya nggak matching. Ada masalah data dan masalah keamanan data dan privasi. Ada resistensi terhadap teknologi baru. Kemudian ada lagi konsep ambient intelligence dan IoT. Kemudian peran database kontekstual dan reasoning engine. Kemudian ada integrasi manufaktur. Nah, di sini kalian nanti akan membuat tugas. Tugasnya di rumah itu besok dikumpulkan, yaitu Anda mendiskusikan tentang contoh baik dari sumber artikel jurnal ilmiah, dari YouTube maupun dari website. Yang pertama adalah implementasi sistem berbasis sensor di lingkungan konstruksi, kemudian peningkatan keamanan melalui pemantauan waktu yang real time atau nyata. Kemudian Anda akan membuat inovasi dalam bahan dan teknologi sensor. Kemudian peran kecerdasan buatan dalam prediksi risiko, kemudian potensi pengembangan teknologi wearable. Nah, sampai di sini masih ada lagi, tetapi Bunda harus bertanya apakah kalian memahami materi yang Bunda sampaikan. Silakan. Untuk mahasiswa K3, silakan.
Alhamdulillah sampai saat ini masih memahami Bunda.
Oh, thank you very much, Abi. Jadi sudah bisa dipahami termasuk tugas. Nah, untuk kelas ini karena jumlahnya 52 tadi ya, itu Anda nanti membuat tugasnya itu jangan lupa kelompoknya itu urut NIM, kemudian dibagi menjadi tadi itu pesennya Getsa mana Getsa? Getsa, tadi Bunda pesen 7 atau 8 kelompok ya?
7 kelompok.
7 kelompok, oke. 7 kelompok kemudian dibuat. Nah, sampai di sini apabila ada yang bertanya sebelum Bunda melanjutkan ke yang lain. Kalau tadi di kelas kita ada senam, kita ada stretching, maka kalian lakukan sendiri ya. Pokoknya boleh sambil tiduran, boleh sambil main minum, boleh sambil makan gitu. Pokoknya santai aja dalam perkuliahan ini. Sekarang Bunda akan memberi kalian waktu untuk bertanya maupun memberikan feedback. Silakan. Bunda tunggu. Feel free ya, nggak usah takut, nggak usah ragu. Pokoknya silakan kalian bertanya.
Bunda maaf mau nanya sebentar. Perkenalkan, nama saya Abi Muhammad Husaini dengan nomor NIM terakhir 093. Bunda izin bertanya mengenai tadi tugas yang diberikan itu, berarti kan kita disuruh mencari dari sumber internet dan sumber manapun mengenai penggunaan IoT dalam menjaga dan mencegah musculoskeletal disorders di dalam tempat bekerja ya. Betul tidak Bunda?
Betul sekali, tidak hanya musculoskeletal disorder, tapi juga mengatasi bahaya atau mencegah bahaya dari baik itu bahaya yang menyebabkan kecelakaan maupun menyebabkan kesakitan.
Oke, baik. Berarti untuk itu apakah kita mengkhususkan untuk penggunaan sensor dan pengambilan data yang dapat digunakan saat ini? Apa kita lebih seperti arah PKM futuristik di mana kita berharap ini akan terjadi di masa depan, Bunda?
Kalau sekarang, kalau itu kan berarti rencana visioner. Kalau bisa yang real, yang sudah ada sekarang ya, Abi.
Oke, sama satu lagi Bunda, kami kita berharap bahwa program yang kita gunakan itu digunakan oleh skala kecil seperti mana hampir semua orang bisa menggunakan. Kalau hal itu saya kurang yakin apakah ada suatu sistem digital IoT yang memungkinkan digunakan. Apa kita berharap untuk lebih besar dengan budget yang lebih tinggi seperti misalkan construction site perusahaan besar seperti itu.
Kalian mencari saja inovasi-inovasi itu yang sudah publish saja atau yang ada di YouTube aja, itu banyak kok yang untuk masyarakat kecil contohnya ya. Contoh itu ada gelang untuk mendeteksi paparan panas berlebih. Berarti kalau misalnya perusahaan skala menengah atau pemerintah itu kan sebetulnya bisa membagikan gelang tersebut gitu. Nah, tapi Anda harus mencari contoh-contoh. Karena Bunda juga sudah melengkapi ada 2 artikel gitu ya yang di situ yang 2 artikel yang udah Bunda titipin ke Gisa ya. Itu tentang IoT dan kalau tadi di dalam diskusi kelas tadi itu ada menemukan YouTube tentang apa-apa mirip seperti yang sudah dipresentasikan oleh Prof. Victor tadi gitu. Apakah kira-kira bisa dipahami? Contohnya, contoh ini kayak gini. Di dalam lingkungan konstruksi itu ada, kalau tidak salah, di Adikarya itu PT Adikarya itu ada sensor untuk menilai apakah seseorang akan terjatuh atau tidak gitu. Itu ada sistemnya gitu.
Oke, baik Bu, terima kasih.
Terima kasih kembali. Ada lagi yang mau bertanya? Memang ini banyak banget ya Anda mendapatkan materi, tapi jangan bingung. Semuanya bisa dipelajari pelan-pelan. Tapi sekarang kalau Bunda sarankan, sebaiknya kalian tetap belajar IoT, belajar apa namanya artificial intelligence dan sebagainya. Sekarang Bunda juga sedang belajar untuk mengembangkan detektor kelelahan berlebih pada petani dan pada ojek online. Tapi karena dana LPDP-nya itu kebetulan Bunda menjadi tim untuk dana LPDP yang diperuntukkan bagi universitas di luar Jawa gitu. Bukan untuk yang di Jawa. Silakan bila ada yang bertanya lagi. Terima kasih Abi, terima kasih Giza. Dan terima kasih loh, tadi banyak banget pertanyaan yang bagus-bagus gitu. Silahkan ada lagi? Ada lagi? Oke, kalau belum ada, izinkan Bunda untuk share screen lagi untuk melanjutkan tentang risk assessment dan risk management. Kalau tadi itu fokus risk assessment dan risk management dalam musculoskeletal disorder. Nah, sekarang kita akan melihat dalam skala lebih luas lagi. Nah, jadi ini contoh sumber artikel ilmiah, jurnal, YouTube maupun website. Implementasi sistem berbasis sensor, kemudian peningkatan keamanan dengan real time monitoring. Contohnya aja ada loh yang real time monitoring untuk mengukur mengukur udara di ambien. Itu misalnya di udara di Kota Semarang itu ada ya, gas CO berapa, NO berapa, gas O2-nya berapa. Itu contoh-contoh itu sebetulnya untuk mengurangi risiko sehingga orang tahu, oh ternyata polusinya sudah tinggi ya gitu. Nah, ada lagi smart working environment, itu bisa jadi inovasi dalam bahan dan teknologi sensor. Pasti banyak banget produk-produk yang diiklankan, disitulah kita bisa belajar. Kemudian peran kecerdasan buatan dalam prediksi resiko, kemudian potensi pengembangan teknologi wearable. Nah, kemudian tugas-tugas kalian selanjutnya adalah menyusun poin penting dari materi asesmen resiko kesehatan kerja, kemudian pentingnya adaptasi teknologi K3 di tempat kerja modern serta tantangannya. Nah, masih ada materi yaitu manajemen risiko. Manfaatnya melindungi pekerja dari risiko kerja melalui proses manajemen risiko. Kemudian prosesnya mencakup analisis risiko, penilaian risiko, dan praktik pencegahan. Kemudian peran pengusaha dalam pencegahan risiko, misal tanggung jawab utamanya untuk melindungi keselamatan dan kesehatan pekerja, kemudian mengidentifikasi risiko dan mengambil langkah pencegahan yang diperlukan. Nah, kemudian menggunakan alat pelindung diri jika diperlukan, melakukan evaluasi risiko secara berkala terutama setelah perubahan tempat kerja. Kemudian dalam konsep dasarnya itu manajemen risiko mempertimbangkan bahaya, risiko, dan evaluasi risiko. Bahaya adalah sumber atau situasi yang berpotensi menyebabkan cedera atau penyakit. Risiko merupakan kombinasi kemungkinan kejadian berbahaya dan tingkat keparahan serta dampaknya. Kemudian evaluasi risiko meliputi proses analisis untuk memahami dan menilai tingkat risiko. Nah, dalam siklus manajemen risiko ini kita mesti mengikuti apa? Siklus PDCA, yaitu Plan, Do, Check, Act. Kemudian identifikasi karakteristik sistem kerja seperti tempat kerja, alat, bahan, dan prosedur. Kemudian tujuan utama mengurangi risiko sesuai prinsip ALAREP as low as reasonably practicable. Kemudian tahapan manajemen resikonya meliputi persiapan, identifikasi pekerja yang terpapar dan deskripsi tugas, dan analisis risiko, yaitu identifikasi bahaya dan analisis konsekuensi. Penilaian risikonya meliputi evaluasi risiko, klasifikasi tingkat risiko, tindakan pencegahan berupa implementasi langkah pengendalian risiko, kemudian peninjauan, serta evaluasi ulang efektivitas tindakan berkala. Nah, ini ada pendekatan baru nih ternyata di dalam model risk assessment ini ada pendekatan kalau kita sering mixed methods dalam penelitian, tapi kalau di occupational risk assessment model itu menggunakan GRI, occupational risk assessment model. GRI artinya abu-abu, jadi ini merupakan penggabungan kuantitatif dan kualitatif. Nah, digunakan untuk sistem kerja yang kompleks dan tidak pasti. Dan fokusnya pada partisipasi karyawan dan pengukuran residual. Ini Anda bisa baca di artikelnya Noah et al. Apa yang menjadi komponen GORAM, yaitu peristiwa berbahaya, identifikasi bahaya di tempat kerja, kriteria pengambilan keputusan, kemungkinan bahaya, faktor paparan, dan konsekuensi. Indikator pengelompokannya, klasifikasi risiko sangat tinggi hingga rendah. Kemudian risiko sangat tinggi artinya tidak dapat diterima, memerlukan tindakan segera. Risiko tinggi merupakan tindakan korektif. Risiko sedang perlu pemantauan rutin. Risiko rendah dapat diterima tanpa tindakan. Ini contohnya yaitu penilaian risiko untuk mekanik di perusahaan manufaktur. Bahayanya jatuh, paparan kimia, kebisingan, ergonomi buruk. Hasil klasifikasi risiko berdasarkan skala metode AHP. Nah, metode GORAM ini relevan untuk lingkungan kerja dengan ketidakpastian tinggi, memberikan solusi sistematis, meningkatkan keterlibatan karyawan. Ini referensinya. Oke, sampai di sini silakan apabila ada yang bertanya.
Bu, izin bertanya.
Boleh, silakan.
Untuk tadi kan disebutkan bahwa kita disuruh untuk apa namanya merangkum data dari itu tadi ya? Apa saya salah tangkap nih?
Iya, betul.
Nah, itu perangkuman datanya dalam bentuk apa Bu sebaiknya? Apa kita menggunakan rangkuman aja atau kita boleh dalam bentuk apapun? Bagaimana?
Oke, jadi merangkum saja apa isi sore ini. Jadi merangkum aja apa yang Anda tangkap seperti Bunda tadi. Nanti juga Bunda akan kirimin juga rangkuman Bunda tadi. Maka Anda nanti masukkan dalam pengumpulan tugas Anda juga.
Baik, berarti kita boleh kayak Bunda ya. Berarti kita bisa poin-poin aja tidak masalah atau apakah kita harus bentuknya paragraf gitu loh Bunda. Saya kurang jelas nih sama itu nih bentuknya.
Bentuknya kalau Bunda kalau lebih enaknya kok PowerPoint ya.
Berarti kita poin-poin dasar aja yang banyak itu ya Bunda ya. Untuk slide-nya sendiri berapa Bunda kalau kayak gitu?
Slide-nya nggak usah lebih dari 10 ya.
Oke, berarti kita poin-poin tinggi saja, terus nanti sisanya kita jadiin PowerPoint seperti itu ya Bunda ya.
Iya, gitu
Oke.
ya. Sudah jelas belum? Berat tidak kuliah itu? Kalau berat harus stretching. Nanti kalau ketemu di kelas. Eh, tapi untuk minggu besok Bunda akan lihat apakah Bunda bisa meninggalkan tempat pelatihan apa asesor K3 atau tidak. Kalau tidak berarti Bunda akan apa klikkan daftar hadir kemudian kita nanti session kuliah pakai Zoom gitu ya. Kalau capek nanti istirahat kemudian mulai lagi gitu ya. Karena nggak manusiawi memang kalau kuliah dari jam 1 sampai jam 4:20 tanpa istirahat itu tidak memungkinkan ya kan? Nih Anda sudah sambil istirahat ya? Kalian semua gimana? Bisa sambil tiduran kok gitu ya. Nah, ini Bunda masih di ruangan apa? Lab komputer ini belum selesai. Nah, gimana?
Aman Bunda, di
Aman ya?
sekitar saya udah tepar kok.
Oh gitu ya. Oke deh. Pokoknya don't worry, nggak harus posisi yang formal gitu. Karena kan memang Bunda belum pulang aja sehingga posisinya apa formal. Itu ada teman-teman juga ya. Hei, yang lain bagaimana? Kok tidak bersuara? Halo Veronica. Halo Winda, silakan yang mau apabila ada feedback dari apa-apa yang sudah Anda eh, lakukan tadi gitu. Anda dapat tadi bagaimana itu? Apakah kuliah tadi itu bagaimana? Seru ya, karena kita ternyata memang menghadapi realitas seperti tadi. Kita itu tidak boleh diskriminatif. Tetapi posisi pesawat terbang mengharuskan postur pramugari itu yang minimal tingginya 160. Nggak tahu 160 apa 158. Tapi kalau tidak salah 160 gitu. Karena untuk apa? Untuk produktivitas supaya pramugari tidak harus memakai sepatu hak tinggi terus gitu. Silakan Abi.
Bu, izin bertanya, untuk tadi kan disebutkan ada tugas kelompok. Tugas kelompoknya itu berarti yang membuat rangkuman IoT peralatan untuk kesehatan, betul?
Eh,
Sedang
tugas
ya.
kelompoknya adalah yang pertama itu adalah ini. Bunda akan tampilkan lagi ya, supaya sejelas-jelasnya. Ya, jadi ini kan ada tugas nih, Abi dan kawan-kawan ya. Yang pertama, Anda akan mengulas contoh-contoh yang sudah ada, baik dari sumber artikel ilmiah di jurnal atau dari
Ya, itu
YouTube.
Bu.
Mm-mm. Mm-mm.
Enggak, Bu,
Gimana?
maaf. Ngobrol sama teman sini.
Oh gitu, maaf. Ya, nggak apa-apa, it's okay. Ngobrol juga nggak apa-apa. Jadi Anda nanti dari artikel jurnal atau dari YouTube atau dari website itu Anda akan, oh ternyata implementasi sistem berbasis sensor di lingkungan konstruksi untuk mencegah kecelakaan itu ternyata ada gitu. Nah, contoh alatnya apa, fungsinya apa gitu. Oh, ternyata ada peningkatan keamanan melalui pemantauan real time gitu. Oh, ternyata ada misalnya apa? Kamera CCTV. Orang itu kalau sudah tahu ada kamera CCTV, orang itu kan cenderung nggak ngebut ya. Iya nggak di jalan tol gimana? Apa yang Anda rasakan?
Betul, Bu, karena kayak kalau misalkan dipantau secara real time kan takutnya kalau ada tiba-tiba polisi di depan kan nanti tiba-tiba ditilang.
Iya, padahal tujuannya bukan takut ke polisi, tapi supaya aman, supaya kita nggak menemui kecelakaan. Jadi pertamanya oke deh berpikir jangan sampai terkena tilang, tapi sebetulnya peningkatan keamanan melalui pemantauan real time CCTV di jalan tol itu merupakan preventive measures atau tindakan pencegahan untuk meningkatkan keamanan berkendara. Iya enggak? Nah, itu Anda nanti uraikan itu gitu contoh gitu. Apakah semua bisa memahami apa yang Bunda sampaikan?
Siap, bisa
Bunda.
Bunda.
Iya, terima
Bunda.
kasih ya. Ini betul-betul Bunda harus nanya karena takut Anda nggak paham, tapi ternyata diam-diam Anda paham. Jadi it's really awesome. Nah,
Bunda,
kemudian boleh silahkan loh.
maaf, afirmasi akhir. Jadi yang tugas kelompok tuh dalam bentuk PPT dan tugas mandiri dalam bentuk PPT juga, betul?
Nggak ada tugas mandiri, semuanya kelompok aja.
Terima kasih Bunda.
Terima kasih Bunda.
Ya, tapi begini, walau kelompok tolong ya, semua aktif ya, nggak boleh mengandalkan teman lain. Karena nanti Anda akan rugi kalau mengandalkan teman lain. Lebih baik Anda aktif, berdiskusi bareng, jangan berdiskusi lewat WA, tapi ketemu bareng kemudian berdiskusi gitu ya. Nah, kemudian ada tentang inovasi dalam bahan dan teknologi sensor. Misalnya tadi Samsung Health itu ya, kemudian Health Up dari iPhone itu Anda punya toh gitu. Kalau yang nggak pakai iPhone berarti Android gitu. Dan ada peran kecerdasan buatan dalam prediksi risiko ya, memprediksi risiko. Dan potensi pengembangan teknologi yang wearable yang bisa dipakai. Nah, kemudian Anda juga nanti menyusun kesimpulan poin penting dari materi asesmen risiko kesehatan kerja. Kalau tadi risiko MSD itu boleh sebagai poin penting materi yang Anda sampaikan. Kemudian pentingnya adaptasi teknologi K3 di tempat kerja modern. Tadi contoh-contoh yang disampaikan Prof. Victor itu sudah masuk ya. Kemudian juga tantangannya. Nah, sampai di sini siapa yang masih ingin bertanya?
Sebentar ya Prof, lagi nanya teman-teman siapa tahu ada yang kurang ngerti kita.
Gimana? Oke ya, berarti oke. Oke, siapa yang ingin memberikan feedback? Apa kesulitannya mempelajari hal tadi? Gitu. Oh ya, jadi besok yang pertemuan besok kalau tidak bisa on itu juga akan ada diskusi. Kalau pakai Zoom juga akan punya breakout room gitu ya. Tapi Bunda usahakan bisa ketemu di kampus gitu. Asal mendapat izin dari kursus asesor K3 gitu. Silakan bila masih ada yang bertanya Bunda tunggu. Kalau tidak ada yang bertanya, Bunda tutup. Apakah sudah selesai? Benar-benar udah nggak ada yang bertanya?
Izin Prof.
Oh iya. Silakan Geza.
Izin bertanya Prof. Berarti untuk tugas yang diskusi kelompok itu kita berbentuk Word atau PPT?
Kalau tadi kesepakatannya PPT ya.
Prof maaf, PPT 2 atau PPT 1? Jadi dua dalam
Satu saja.
digabung berarti ya?
Ya, dan jangan lupa pada slide pertama ada judul dan nama kelompok ya. Nama-nama kelompok jangan ada yang tertinggal. Karena ternyata banyak kejadian di kelas-kelas yang lain itu mahasiswa yang nggak aktif sering dilupakan ke temannya. Maka jangan jadi mahasiswa yang tidak aktif. Semua harus aktif, memastikan membaca hasilnya. Kejadian tadi di kelas sebelum kuliah dari Prof. Victor ini tadi ada yang tidak aktif, tetapi Bunda kan mengharuskan presentasi satu persatu harus membaca. Nah, yang nggak aktif itu akan kelihatan nggak siap gitu. Nah, kalian semua mengapa aktif itu penting? Karena aktif adalah untuk diri sendiri, untuk kompetensi kita juga gitu. Oke?
Baik, terima kasih banyak Bunda.
Oke, terima kasih. Ayo, siapa lagi yang masih ingin bertanya? Ayo. Apakah kalian mempunyai, kalau nanti belum mempunyai daftar kelompok yang urut NIM, nanti Bunda akan titip ke Giza untuk langsung membagi dari form nilai. Dan jadi Bunda akan memberikan nilai dari hasil session per session, tapi nanti Bunda nggak akan memberi UAS karena UASnya biar dosen lain saja gitu ya. Apakah mau sampai sekian atau masih ada lagi? Halo?
Dari saya cukup, Bunda.
Oke. Terima kasih. Kalau begitu, izinkan Bunda untuk melanjutkan lagi pada kegiatan lainnya gitu. Wassalamualaikum warahmatullahi
Waalaikumsalam warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Bunda.
Terima kasih Bunda.
Terima kasih Bunda. Terima kasih Bunda.